The first point I'm trying to make is that ovarian cancer has evolved rather dramatically over the last 30 years that I've been involved. Fortunate enough involved, honored to be involved in caring for patients with this very difficult illness. It's evolved from what I think could be called basically acute management. Sudden onset of illness, which hasn't changed in terms of the initial presentation, but basically surgery, platinum chemotherapy, and if the patient did well, great. If not, there was not much else to be offered. Very acute management, short term, didn't have much else. The initiation of therapy in ovarian cancer remains really quite similar, although the drugs are certainly less toxic and more effective than when I started. But the difference is we now have many options, an increasing number of options available to our patients, including far more precise therapies such as PARP inhibitors, but that the illness has transformed itself in many patients into really more of a chronic illness, where we're managing patients now not over a period of months, but increasingly over a period of many years. Doesn't mean that the disease isn't fatal, ultimately, in the majority of patients, because that's still true today, but we're not talking about 1 year or 2 year survivals being sort of the norm, but often 3, 4, 5, 6+ year survivals being the norm with illness, often, requiring therapies most of the time, but allowing patients to have good quality of life. And that change in the focus means we've got to think differently about both the drugs and regimens we use, how we sequence them, trying to be more precise for what's of clinical utility for that individual patient, but increasingly on the symptoms, because the symptoms are not just what the patient feels today or tomorrow, but what they might feel if they're persistent symptoms, for example, like neuropathy, they might feel for the next 2, 3, 4 years, and the impact on quality of life. So my point in my talk always going to be we've got to very much reconsider drug development strategies, selection of treatment strategies, regulatory approval strategies as we move forward in coming up with concepts in the management of ovarian cancer.